Hey everyone, so I'm Lauren. This is another episode of Autonomous Wellness, and today I'm going to talk to you guys a little bit about your pelvis. So your pelvis is actually more of a heart shape. If you think of it as a heart, basically on the front, like kind of horizontal, I guess, or parallel to the ground. Your pelvis can actually move in a bunch of different ways. It's attached by cartilage in the front and some joints in the back, and it can move forward. Each side, it can move backwards, and they can flare in and they can flare out. So sometimes what happens is, if you think of your pelvis like a system, some of the muscles on the front can pull it forward. It can pull one side forward, or the muscles on the back can pull it backwards. So a lot of times what happens is one side of your pelvis gets pulled forward. The other side either just stays where it is or kind of pulls back to try and compensate for it. Now, what you can do is I'll show you a quick trick to try and kind of figure out if your pelvis is tilted forward or rotated forward, and then what to do to at least try out to see if it helps. Again, something that you probably are going to want to check out with a healthcare professional, because a lot of times that hip that is rotated forward is going to get a lot of pinching. It might hurt to put your socks on, to go upstairs, to basically just lift that knee up at all. So what you're going to do is, I'm going to do this here, but you can do this in standing, is you're going to find your two bony parts here. You're going to want to go below them. So I'll kind of show you guys here. You're going to want to go below them. So if you can kind of hook underneath them and see if one side is forward at all. Typically, my right side is a little bit gets pulled forward. My right muscles on my right side tend to be a little bit tighter and pull it forward this way. So I have to be really careful about that, or I'll get pains in the back, kind of in that SI joint area, or even get pinching in that right side. So this is super easy to do in front of a mirror, or if you get used to it enough, I can already tell that my right side is down. So I'm going to show this to you guys with the right side and how I fix it, but feel free to switch it up. It's just going to be the opposite if your left side is pulled forward. Okay, so what you're going to want to do is grab a pillow. You're going to lay on your back, put the pillow between your legs, and you're going to squeeze it. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. And I'm going to do that 5 times. One more. What that is going to do is it's just going to kind of reset your adductors, the muscles on the inside of your thigh. Next thing you're going to do is find a wall. You're going to get your behind kind of close to the wall, but you want your knee to be at 45 degrees, or at 90 degrees, sorry. My bed's a little bit in the way, so it's kind of a tight squeeze, but you're going to put your right leg, if your right one's pulled forward, you're going to put your right leg on the wall, and you're going to use that heel to push the wall away. While you're doing that, you're going to bring your left knee with your left hand, and your left knee is going to come pull towards your face, but your left hand is not going to let it. So it's a pull and a push. So you're pulling and pushing at the same time, so it doesn't actually go anywhere. So while you're doing that, this takes a little bit of coordination. You're going to be pushing the wall away. So you're pulling here, pushing here, but this hand is kind of stopping that motion. So push here, pull here. 3, 4, 5, relax. Push, pull, 2, 3, 4, 5, relax. Right's pushing, left's pulling, 4, 5, relax. Right's pushing, left's pulling, 4, 5, relax. Okay, then what you're going to do is do a couple of bridges. 3, 4, I like to do about 5. And that's gonna kind of reset your system. So what you're doing is, because the right side, my hip flexors are on my front side, and they're pulling my hip forward. What I'm doing by pushing into the wall is I'm activating the glutes and the muscles on the back to try and pull it backwards. And on the left side, I'm activating the opposite. I'm activating the hip flexors to basically kind of hold this in place while I pull this one back. So it's kind of a rotating motion like this. And then you just do the bridges to kind of reset the system. And then you can go back and see if they're more level. And I already feel that my right side's a little bit more level. So I did this for one of my friends because she was having hip pain in the front, and I thought that this might be able to help her, and I actually ended up helping myself. So that's pretty cool. So I hope you guys enjoyed this, and if you have any questions, feel free to comment below. Thanks everyone. Bye.